It just feels so weird inside of my body. Whew. Well, I can't show you because my coochie's not covered. So you have to wait. Am I not good enough for you? I'm currently losing a stomach. Beyond brave to be awake during this. Well, it's an awake procedure, and it's not nearly as awful as I thought it would be. And I have a really dope doctor and her assistant lady doctor over here. They're pretty dope. So it's made things a little easier because I was shaking on this table like 30 minutes ago. Everything was shaking. My feet, my hands. It was bad. It was bad. Much better now. Adele's been really hot in this office today. Yeah. This is like the third or fourth Adele song.
It's a satellite radio, so
this is Adele popping. Thanks, guys. Thank you. Thank you. I think what made me so nervous is that I'm gory. You know what I mean? Like blood, fluid, fat, like suck out. Just that is what did it for me. And I think that made me more nervous than anything else was just knowing like tubes and stuff inside your body. That's the part that got me. But they're about to, she liquefied everything and they're about to suck it all out. New body, who this loading? Yeah, I had no idea either. She was like, stop worrying. It's not that serious. You'll be fine. Don't stress. It's easy. When she said you'll be able to be on your phone the whole time, I was like, nah, this lady is tripping. But yeah, the worst part is the numbing stuff because you feel those needles until you're numb. But so far, so good. Hey, hey. So with this garment, I know I'm getting a second one, but do I need to wear a waist trainer after the 2 weeks?
You can wear the garment longer than 2 weeks. 2 weeks is the minimum, but most people wear it longer and they wear a waist trainer on top.
On top. Mm-hmm. Oh, these bitches are trying to be.
We don't want you to. Sometimes what the waist trainers can do is when you have a lot of fluid and stuff, we don't want you to basically cause artificial creases and stuff. So the garment we give you is a smooth covering. So when you have the fluid and your body's healing, sometimes when patients come in and they've worn their own garments that have a lot of creases and linings, it creates those creases in their abdomen.
That's why I asked her if she would order me in a duplicate of whatever you guys
give. So we have some patients that will definitely put a waist trainer on top, but we always say if you want to use a waist trainer, it's totally fine, but definitely use a garment first. Like our garment.
That feels terrible around my belly button. It's burning.
Yeah, the belly button can be a little bit sensitive, but I can put in more numbing fluid.
Yeah, it burns.
All right. Go ahead.
Oh, right there.
All right. So you also have a lot of scar tissue and stuff, which is really sometimes hard to numb. So sometimes the average amount of fluid that we can put in isn't what you need. You would need a little bit more, which is fine, because we can always stop and put in more fluid. As long as you're comfortable. Yeah. And that's why we can't do a lot of areas all in one day.
In one day, yeah.
Because there's a limit to how much fluid I can safely put in you that your body can safely excrete.
Right.
And also, we remove a large volume, right? So, like, when you go to a lot of places, they'll be like, oh, yeah, we'll do, like, 5 different areas, and they'll remove
a quarter of what they should.
Yeah, like, they'll remove it. It happens all the time.
Because they're doing it quick.
Yeah, like, I've had so many patients that come in from Miami, and they'll be like, oh, yeah, like, I had it done. And I'm like, well, it looks like you never did.
Right.
But they're like, yeah. I'm like, well, what happened? They're like, yeah, I did, like, my stomach, my thighs, my abdomen, like, everything,
and they do it all, and they only have so much time before shit wears off.
Yeah. And there's only so much that you can take out in a given time, right?
Right.
So that's why we have to break it up. So, like, that girl that I was telling you about that I removed about 3,000, like about
15.
Yeah, so there's a limit. Like, I couldn't do more areas for her because I want to give her the best result in each area.
Right.
But
hi. Did you bring food?
Jen will tell you.
Did you bring food and snacks and hoagies?
No, but I see them
Just
in
kidding.
the tube.
She's sucking them out.
Salads and salmon is what I meant.
Yeah. So this is, yeah, I mean, if you need it.
Okay,
Just for that.
Thank you.
Waste not, want not.
Right?
I use
The band?
Sugar snatched
They're nice,
leaves.
right?
Stupid.
perfect, tightness.
Awesome.
Yeah, it was perfect.
Ow.
So you want to see the fibrous band?
Yeah.
So you see, that's when I'm going back and forth. It's a little sensitive, so that's why. These little bands is basically your skin attached to your muscle, and so it can be a little bit sensitive.
Okay.
So, but it's fine. Everybody has them, and it's really common for women to have it, especially after they have children or they have stretch marks and stuff. You doing okay?
Mm-hmm. When I got lipo, they put me to sleep. This isn't that kind of lipo. So can you tell my very concerned following?
Yes.
This is a very different lipo procedure called smart lipo, and you don't go to sleep.
Right. So
Just for the record.
You do not have to be put to sleep. So even with traditional lipo, so when we do BBLs here, I do fat transfers to the breast, the patients are not put to sleep. They're awake. And the reason that sometimes patients get put to sleep is for patient sometimes comfort, because they don't want to feel anything, touch anything, they don't want to hear anything, so they get put to sleep. But the most risky thing in any procedure is going to be general anesthesia. So if you can avoid it, you should.
Right.
There's no reason to be put to sleep in this day and age for something like that we're doing to you.
Right.
And a lot of patients like the idea of being awake and not because anesthesia scares a lot of patients as well.
Right.
Being put to
Yeah,
sleep.
yeah, yeah.
Because that is the most risky thing usually when it comes to surgery. But yeah. And so you do not, and so like I mentioned, when I do BBLs and fat transfers to wherever, it's just liposuction that I'm doing because you can't destroy the fat cell.
Right.
So I can't smart lipo you.
Right.
I have to harvest the fat.
Right. So you can put it.
So I can put it somewhere.
Right. Right.
Talisa, can I go over some
Yes.
aftercare instructions with you?
Yes.
Alright, so when you leave here, you're going to be leaving here with antibiotic ointment and Band-Aids over top of your
Okay.
incisions.
Mm-hmm.
You're also going to have some sanitary pads. It's going to help collect the fluid that you're going to be leaking.
Okay. That
You
sounds
can-
delicious.
Uh-huh. You'll be leaking anywhere from 8 to 24 hours after the surgery.
Okay.
Okay? It's nothing that's gonna be crazy. Your bed's not gonna be saturated.
Right.
If you take an old bath towel and wrap it around you, that should actually be good enough.
Okay.
But you need to keep your garment on for a full 24 hours. Okay?
Okay.
After the 24 hours, you can take your garment off. You're gonna put it in the washing machine.
Oof.
Okay? When you put the garment in the dryer, that's when I want you to get in the shower.
Okay.
I want you to get into the shower with the Band-Aid still on.
Yeah, she said that.
Okay? When you come out of the shower, you're gonna take the Band-Aids off.
Change them.
Dry the area really well. Put a little antibiotic ointment and a new Band-Aid.
Okay.
We're going to give you all the antibiotic ointment and Band-Aids that you need. Once you run out of them, stop using them.
Okay.
You don't want to continue with them and keep covering them. You can get really...
Come on in, it's a party.
You can get really thick scabs if you continue.
Okay, yeah.
So you don't want to do that.
Okay.
For the next 3 days, you want to drink something with electrolytes.
Okay.
Gatorade, Smart Water, coconut water.
Okay.
Life Water has
No
electrolytes.
Malibu, no rum, no...
No alcohol.
Okay. All right. For how long?
1 week.
Okay. All right.
Okay?
All right. I could live without mimosas for a week.
All right. Better
do
you
that.
than me.
I could do that. I know, right? Damn it.
And then this is very, very important.
What is that?
This is your massage ball. Okay?
Let me see it. Oh. Okay.
Okay? You're going to use this today as much as you possibly can.
Okay.
Because you're going to be numb.
Okay.
Okay? Tomorrow, you're going to hate this thing.
Oh, it's gonna be sore and hurt
It's going to be
everywhere.
sore. So, we give you Tylenol with codeine to take for pain.
Okay.
You don't really need it for pain.
Okay.
You're not going to be in pain. You're going to be very sore
Sore.
when you use this massage ball.
Okay.
Okay? Take a pain pill, wait about 20 minutes, and then pick up your little friend, and you're
Okay.
going to start massaging. You want to
Okay.
go in a circular motion,
Okay.
and you want to use about this much pressure.
Okay.
Okay? This is going to help get rid of any fluid that doesn't drain out of your holes.
Mhm.
This is going to help it from, it's going to prevent it
Ow.
from hardening up.
Okay.
Okay? So the
Now
numbing,
I have a girl that does massages and she's supposed to be scheduled to come see me. When should I schedule that for?
so does she do lymphatic massages?
Yeah.
Every therapist has their own set of rules for post-lipo.
Okay.
So what I would suggest is you call her, tell her what you had done, what area you had done, and when does she suggest. Because
Okay.
like our woman suggested 5 days post.
Okay.
But then there's another woman over in Jersey who suggests 7 to 10 days.
Okay.
So it's totally up to your therapist.
Okay.
Okay. Your garment, you have to wear that for 2 weeks straight. If it's
Okay.
not in the washing machine or you're not in the shower, it
It's on
needs
you.
to be on your body.
Okay.
The importance of this and the garment is more than you could imagine. We're doing our part. This and the garment is your
what's
part.
the work. Okay.
Okay. So right now you have muscle, fat, and skin.
Yeah.
We're taking that fat away. So we're going to leave you with muscle and skin and a big, dead, empty space.
Yeah.
Well, we want this skin
To contract.
to lay nice and flat on top of that muscle. Right? So, every time you pull the garment down, you're ripping off that new
Right.
connection that we've made. Okay?
Okay.
So there is a hole to use the bathroom.
Okay. Both bathrooms?
Both bathrooms. So I know it sounds weird and I know it sounds gross, but
Don't take it off.
it's 2 weeks of your life.
Yeah.
You know what I mean?
You'd be okay.
And it's gonna make a beautiful
Baby wipe it out.
result for so much longer than 2
Right.
weeks of your life.
Right.
Do you have any questions?
No.
Okay. If you
No
think
questions.
of anything, you can always call our office.
Okay.
Even if we're closed, I'll be on call, so you'll get a call back from me, and we can go over anything that you are questioning.
Okay.
Okay.
All right.
Okay.
Fucking belly button, man. It hurts.
That area, yeah, it's a sensitive area.
You doing okay?
Yep. For some reason, when I see it, it's not as bad as when I don't.
Really?
Yeah. Oh, belly button. Oh, you hurt so bad. Ugh. It burns on the right side of my belly button really badly.
On the right side?
Yeah. It feels like fire.
This side?
Yeah.
I'll put fluid in.
Yeah, right in there.
You okay?
Mm-hmm. Oh, 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 oh. Oh, that hurt.
A lot of fibrous tissue.
Ouch. What does that mean?
Nothing. It's just the way when people have a lot of fluctuation in fat and stuff, and sometimes it's genetic.
Shit.
Stace? Can I have more fluid?
Of course. One sorry.
No, it's fine.
Ow, 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 ow.
What are you feeling?
Burning.
Doing okay?
Yeah.
Okay.
It's like the further you go up towards the middle, the more I feel it.
Well, around here?
Yeah.
Okay. That's where your ribs and stuff are. That's where your ribs are. So it can be a little sensitive there, okay?
Yep. Okay.
All right.
Okay. All right, okay, all right, okay. Whew.
All right, I'm gonna let the fluid settle a little bit and soak up, okay?
All right.
All right.
Okay. Can I drink or will it come out of my pores?
No, you don't have it.
Okay. Ooh, once I start feeling the pain, man,
Yeah,
I gotta.
That numbing fluid just
I gotta
soaks it,
take a
softens
second.
the fat, and then you'll be numb in a few minutes.
Can you see my box?
Yeah. Let me cover
Okay.
it. Go ahead, do it now.
Cause you know Instagram don't play. They'll kick me off. They'll kick me off. Like, oh, you're showing a vagina. So far, this is what surgery looks like. The fact that we're at a place in time where you can actually do this completely awake and like with your cell phone on the table and like it's just incredible. Right? Modern medicine is insane.
It is awesome. So you see your canister of fat over here?
Where is the canister of
Right here
fat?
on the red. See right there?
Ew. Hold on, let me zoom in. Ew. There's pieces of my stomach. Looks like oatmeal. Ew. Whew. It is kind of crazy. It is kind of crazy, not gonna lie. It's kind of crazy. The fact that you can be in surgery like this is nuts. My belly looks huge right now.
It's full of fluid.
Bigger than it was when I walked in.
Show your belly before all the fat comes out. It's going to totally look different.
Me too. I'm really excited to see the results. I can't wait. I still have to do my sides. So I'm going to be on the table for another probably 2 hours. I know. The music is different. I can't wait to just see my vagina. I'm so excited. I don't know if you can see the holes. Can you? Can you see the incisions? I'm not sure if you can. Y'all are on the table with me. I know that's right. Thank you, ladies, because I'm nervous. I get a little shaky and a little nervous, but I got this. I look at the piece so bad. So they're gonna do all this on the side in a minute. Shake me out all nicely. Getting all open now. Thank you. Yes, I'm awake the whole time. I am awake the whole time. Because though I can't pull you in because then I can't save this at the end and I want to save it. I'll pull you in the next one. I love you too. Stop being a worrywart. I'm fine. I almost said something inappropriate. It's alright. Every time you come on my shit, I say something inappropriate about you. And I've been inappropriately digging through your OnlyFans too. I just came from working out. You make me want to go back and do some more. Yes, yes. Your Cardian are there with you and us. Thank you. You're my inspiration if you never knew that. Thank you. Does it hurt? Yes, bitch. So the worst part is when they put the needles in. When they put the needles in to numb you, that hurts. That definitely hurts. But after that, it's just like uncomfortable. It's like uncomfortable. I can't explain it. Plus, it's like your stomach, so like it's like an area that you don't like have a lot of muscle in, and it's an area that like, you know. So pain level, I would say after when they put the things in, is like a 6, 7. Sometimes 8. It's like a stick, like a quick pain. It's not like a forever pain. It's like a quick pain. But it definitely doesn't feel good. I'm supposed to be on like codeine, Tylenol codeine or something stupid. So not really like pain meds. You know what I mean? what made you want to actually really want to do this? Because as I'm working out, I'm shaping up, but I'm shaping into a weird way, like a very weird way. Are you just feeling tugging? Yeah, well, I'm not feeling anything right now because they stepped out to put more numbing stuff in me. But yeah, it just feels like kind of like tugging and pulling and like, I don't know. I had a C-section. So for me, this is like not crazy because I had a C-section. You know what I mean? But look how bloated I am. Do you guys see? Is this your first lipo? Yes, it is. If I pee on this table, y'all, it's your fault because you said I didn't have to pee and it's just the water in my belly.
We can give you a bedpan.
Seriously, I feel like I have to pee. My stomach is dropping. Now I'm losing weight. Oh, thank you, Eileen. Am I going to be scarred up all crazy after? Doc, am I going to be scarred up all crazy after?
No, your incisions are about 2 millimeters. We use micro cannulas, and that's everything is blunt. So your incisions are about 2 millimeters.
So no.
And we try and hide incisions all the time. So these two incisions are hidden in the panty line.
Panties, yeah.
Sometimes when people have tattoos, we hide them in tattoos, moles, because they're so low.
Oh, yeah.
So we try and hide our incisions as best we can for patients.
So this part right now is sucking it out?
Correct. You're sucking out your melted fat.
I look big as hell on this damn video right now. My stomach looks so huge.
Well, you also have fluid in it, remember?
Right. I just got pumped up with
You got pumped up with fluid.
gallons of fluid. Just a little bruise, no bruising. You hear it? Oh shit. Oh my God. I'm trying to give you guys a good sneak peek, but my vagina is out and I'm not trying to be kicked off Instagram for the next 3 weeks while they figure out that it was just a surgery. So you're gonna have to see what you can see. Right now she's doing like my lower belly button area that fucking sucks and hurts so much.
Yeah, you have a lot of stretch marks there.
Yeah.
So those babies did you dirty.
Oh, those stretch marks is why it hurts.
Yeah.
Yeah, it pulls down onto your
It pulls down on your
you're
skin.
breaking the scar tissue from underneath.
Yeah, they're the little bands I was showing you.
Oh, you bitch. That's what it is.
Yeah, it's those
damn
little kids. It's the kids. They did it.
Mother Fletcher. Because that feels different than anywhere else
Yeah.
in my body.
That's why I say I always tell the moms, I'm like, your babies do you dirty all the time.
Damn. Especially over on that side. Ugh.
And you'll always have a sensitive side. So, but you're doing phenomenal, okay? You want to see? Look. You see, so that's why, because you have a lot of that, so it's a little bit hard.
Do you have a choice whether to be awake or under anesthesia, or did you choose to be awake? She was saying earlier that anytime you want to not do general anesthesia, you want to not do general anesthesia because it's a bigger risk, with surgeries. And with what they do now, it's like not that serious to have the need to do that. Am I right?
Correct. You do not need to be put to sleep to this. And honestly, I feel like you get better results when patients are awake, because especially for you, when I'm doing your waist, you're gonna be moving all over, all around. You're gonna go on your hips. That's when I get to give you that really nice curve. Actually,
right.
When you're on your hip, when you're put to sleep,
it's harder.
It's
to
hard.
Move a person.
Yeah, you're dead weight essentially. Nobody's moving you around like that. And it's easier. And actually, when I'm done your stomach, I actually have you sit completely up, because when everyone's flat, they'll look all nice and flat.
Yeah.
When you sit up, you'll see high marks and stuff.
Yeah.
So I do think you're able to get better results when patients are awake, because you can move them around and stuff.
Gotcha.
And also it's for patient safety. If you don't, I think about it like me, what I would want my family to do. I would never want them to be put to sleep if they didn't have to be put to sleep.
Right.
Like when I got my wisdom teeth out, I was awake. I got 10 shots of Novocaine in my mouth, and they pulled them out.
Yeah.
I was awake. If you don't have to be put under, I don't think you should. Now, granted, if someone's doing something like a tummy tuck, like a breast lift, and they also want lipo, well then it's better to just get everything. You're going to be put to sleep anyway, so you may as well do it. But it really depends. I actually have so many patients. I've never once had a patient say, oh, I don't want to do lipo because I'm going to be awake. I've never had that.
Right.
All my patients, or all the people that walk through the store for the consults, they're always like, oh, I get to be awake. Thank you.
Mm-hmm.
You know? Because that's what I would want.
So you use the same hole to go through everywhere?
Yep, so I use 2 holes here, 2 holes here. I'll do your full abdomen. These 2 I actually use to also give you your contour.
Okay.
Then I'll make only 1 in the back probably. I try to minimize the incisions too.
Right. I don't know why this is less stressful watching it. Yes, so it's called Smart Lipo. It's been around, I don't know.
It's been around since around the early 2000s. But the way we do it here is we do Smart Lipo plus liposuction. So sometimes places, they'll just laser, and then they'll, kind of I was talking about before about full sculpting, they'll kind of laser and then kind of let your body do what it has to do to kind of get rid of all the fat that we destroyed. But here we lipo after we melt all the fat. But it's not only about melting fat, the laser helps your skin to tighten. So it's a phenomenal technology. It gives smooth results. People they're not left wavy, bumpy, lumpy.
Right.
And if I'm not able to get like a little pocket, if I melted it, your body's gonna get rid of it.
Right.
When you do traditional lipo, if the doctor misses it, it stays there because nobody destroyed it. So it's kind of like also helping us.
That shit look crazy. How she just go in and out like that, Jim, and that John like that. I know. She's gory. She's different. She's the different kid out of the family.
It's around your ribs, sorry.
Oh, that hurts. How long are you going to be in pain after? Like 3 days?
Yeah, and it's not really pain. It's really soreness, like you worked out. People describe it as doing an intense workout.
Mm-hmm.
You doing all right?
Mm-hmm.
By those little stretch marks. And blame those kids. All right. I need you to take this hand and put it above your head. Okay. Yep, perfect. Is this okay?
Yep.
Good. You want to see the fat?
Yeah.
Right here.
Gross.
Gross. That's your melted fat coming
So is it white or pink or both?
It's yellow.
It's yellow.
You have good quality fat though.
That doesn't feel good. That doesn't feel good.
You Can we put more numbing fluid?
Oh, yes.
Yes?
Right there.
Right here?
Yes.
Okay.
When my glasses go above my eyebrows, that's how I know I'm squeezing too hard. My butt cheeks are hurting now because I've been squeezing so hard. I got a gluteus workout while I'm here. A auto BBL by default.
All right, go ahead. Better?
You right there, right there, right there.
Okay. Better?
Yeah.
Doing okay?
Yeah.
Good. Perfect.
Y'all keep telling me to breathe. I am breathing. Shit. What does it feel like besides pain, though? It feels like... So the one thing that I think is the reason why it's so freaky is because you're in control of your body, right? Until someone else is playing inside of it. And then it's like the feeling of the tools inside of you is very like awkward and weird. It's not like a baby. It's because it's not in that part of your body. You know what I mean? Because it's in stomach areas, and especially like above the belly button. Once you start playing there, nothing ever happens there, right? Like you don't move much muscle from up there unless you're targeting that muscle. You know what I mean? So it just feels like awkward as hell. Like right now, what she's doing doesn't hurt at all. It just feels really, really weird.
Yeah, I mean, you're going to have some areas that are sensitive and then some that are not. And honestly, when I do maybe your love handles or whatever, you may not feel anything. Each area is different. And the fact that you have some stretch marks is probably making you a little bit more sensitive. And like I mentioned, scar tissue and stretch marks, fibrous tissue is harder to numb. But we're getting there. You doing okay?
Mm-hmm.
Good.
So how long does the stomach take to do?
It depends on, so like for you, have had to stop a few times and infuse more fluid.
Right.
So it depends on each person. And I always want the patients to be comfortable, so I always stop.
Yeah.
I don't like power through. So if you were not as sensitive, then we would have been probably, we would have been
Almost done?
more. No, not almost done because I'm a little bit anal and it takes me longer. But
Right. Which is why we chose you.
yeah. But yeah, so it really depends on how tolerant a person is. And sometimes even if you're not that hard to numb, but you just have fibrous tissue just because, it's harder to suck out. It doesn't melt as well.
Okay.
So sometimes.
So certain fat's easier to work with than others.
Oh yeah, 100%. And fibrous fat is actually harder for patients to lose on their own too.
Yeah. Tell me about it.
Yeah, I know you know because you're living through it, but.
Yes, baby, I'm okay. My cousin's like, are you okay? Are you okay? She just keeps asking, are you okay? Yes.
She's doing great.
I'm okay. And she's not going to take my kidney. So
No.
we're right here in Pennsylvania. Center for Smart Lipo.
Yep, Center for Smart Lipoplastic Surgery. We're right by Sesame Place.
Yes, this is the Sesame Place for adults. This is where we go to play.
I've had that.
Make our dreams come true.
I've had some patients come in from like Delaware and New York and
Send the kids across the street.
yeah.
Yep.
Or like for their follow-ups, they'll make it like an outing.
Mm-hmm.
The kids would go to Sesame Place. They'll come in for an outing and then they'll take them out.
Yep.
Because I've had patients. I had one person coming in from Illinois in like 2 weeks.
Yeah, they come from all over to see you, don't they?
Yeah, they do. They tend to. I had these I had these two sisters came in from 3 hours away. They didn't tell anyone what they were doing. And they just, they drove down. So, I mean, we have a hotel right here, so they stayed at the hotel.
I'm 5 minutes from Sesame Place. Well, then you're 5 minutes from me.
Yeah, you're 5 minutes from us. Then.
I'm right over here. I'll be done at 3:30. You can meet me over here and say, hey. My cousin.
You doing better?
Yeah.
Good.
So yeah, we chose this doctor because she had the most incredible reviews. She had, literally that's what we based it off of. Like, how good is her work? What do people say about her? And that's why we chose her. Yeah, if you Google them, they're very, very well rated on Google. They need to get with their Instagram page. I don't know what y'all are doing.
I know. So I
2016. I was like, what the hell?
I have a lot of befores and afters that I've been trying to work on the Instagram page.
You need to get those up.
I know.
That's what people are looking for. That's the first place I went to.
No, I know.
He's like, did you look her up? I'm like, I didn't really find anything. He's like, did you Google her? I'm like, oh, right. Right.
Yeah. I know.
Are you just doing your stomach and hips for now? Yes. That's what's up. Thank you, Doc, for taking care of my cuz. I appreciate you.
Oh, of course. She's doing great.
Sesame Place in Langhorne. Yep.
Yep, that's the one.
That's the one. I think it's the only Sesame we have, right?
Yeah, I think so. I think it's only one in the country, I think. Actually, I think it's only one in the country.
Is it?
I think so. Are you doing okay?
Yeah.
Good.
It's just uncomfortable.
So you see, this is like getting emptier.
Ew.
Yeah.
That's disgusting.
And this is still
hard.
Yep, but this is empty. And the skin will tighten, okay?
It better.
Oh, it will.
No, Papa brought me. He would never let me come by myself.
I can have this hand up.
Yep.
Thank you.
Oh, I lost my towel. The green one.
Oh, that's
Sorry.
okay. It's only to keep you warm.
Gotcha. Here, I'll take it in this hand. Thank you.
Is this better on this side now?
Yes.
Okay, good.
Much better.
Good.
Before it was like really burning really bad.
Yeah, then we'll just put more fluid in. We want you to be comfortable, so it's not a big deal. I also lasered you extra because of the stretch marks to help tighten better.
Okay. So I saw a thing about like touch-ups in the paperwork. Is that common?
Touch-ups are not that common now. But there's always people that are never going to be completely clean.
Yes.
You know? Like, that's why during my consults, I'm always careful to tell them, like, just because I do lipo doesn't mean I'm giving you abs.
Right,
like, you know, I'm not doing anything to your muscle. And then so patients come in and they think, you know.
They're going to leave with the model body.
Yeah, exactly. And so you can't always satisfy everyone. You have to have realistic expectations as to what liposuction can do for you. And I mean, like I mentioned, I remove until I get empty like I showed you.
I'm actually curious what you do when you get liposuction and you have stretch marks on your stomach. Is there any way they can get rid of them or do something to make it look better?
What was the question?
She said, I'm curious, what do you do when you get lipo and you have stretch marks on your stomach? Is there any way they can get rid of them or do something to make it look better?
So there's a few different ways. So Talitha actually has really good skin quality. So she didn't need to do anything like a tummy tuck, but sometimes, unfortunately, it happens where women will get really, really crepey skin, loose skin after they have children because their skin gets really stretched out. And then they're left with that kind of like around the belly button, like their belly button doesn't look like it's kind of a circle anymore. For those patients, when they get they would really be candidates for tummy tucks and not really smart lipo. That level of skin contraction, I mean, you can't really get, smart lipo is intended for moderate skin contraction, or for skin laxity when your skin is loose. It's not gonna work to contract down and make it completely flat when you're already starting off with very loose skin. Right. So for those patients, it's tummy tuck is suggested. And when patients get tummy tucks, some of their lower stretch marks, they go away because a lot of it gets pulled down and cut away. Right. But in general, the treatment for stretch marks, I mean, this will make it a little bit smoother, but the treatment for stretch marks is CO2 laser resurfacing devices and microneedling, which we do. So we actually have a patient that our esthetician is doing treatment for her stretch marks on her butt. So she's doing a series of microneedling treatments to help soften up the scars. The best times to get stretch mark treatment is when they're fresh, when they're red, and it's harder a little bit when they turn white and they've settled. Yeah. So the red ones, the fresh ones, are easier to really treat.
You guys are giving my girlfriend ideas. Honestly, I was so nervous. I went to 2 other offices in the past, and when I came here, I just felt really good. That's why, outside of the Google reviews, like she felt like she cared about what my body was going to look like after. You know what I mean? She was honest about like my expectations and just, a stickler for perfection. She appreciates her art. And I dig that. You know what I mean? She's like sculpting people and sculpting art, and she respects it like that. So I thought that was dope. Y'all know I'm a big energy person, so I read her for filth immediately. Immediately. Can you feel anything? I feel like I have to pee. I don't feel what she's doing. Like the one thing, I mean, I do feel it, but it just feels weird. It doesn't feel painful. It just feels awkward.
So yeah, you will always feel movement because lidocaines, we have different receptors. There's pain, sharp pain, dull pain, vibration. They're all different receptors.
Yeah, vibration is a good one. So that's what I'm feeling.
Yeah, so you will feel stuff like that because we didn't do anything to block those receptors. So you won't feel that sharp pain. But you will always feel movement. And so I always tell patients, like, listen, when you feel movement, don't expect to feel something sharp. You'll always feel movement. Because patients brace themselves, and holding your breath makes it a little bit more uncomfortable. So patients forget to breathe. So this is a fibrous band with a little bit of a fat cell at the end. That yellow thing. So that's a fibrous band. And it has a little fat cell at the end.
That's my French fries from about 6 months ago. So I'm usually pretty gory, but now that I've relaxed, I'm kind of okay. For me, it was like the big needles and the cannula or whatever they call it.
Cannulas.
Cannula, the huge like.
But they're blunt. They're like
long
straws.
Needle thing.
I can't cut you with them.
Yeah, they don't look like that though. They look like daggers. Okay, they look like daggers, and they look like they're gonna hurt. And because you can't really feel a whole lot, it feels like she's poking 17 different holes in your body. Like it feels like she's just going along and like poke, 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 poke. Ooh, ooh. See, sometimes it hurts and it feels like a pinching, cramping feeling. Like I can't. It's hard to explain to you, ladies. I'm trying. The downtime is like 3 days. The girl that was here, she said she did it years ago, and she went to work the same day.
Oh yeah, she came into. I've had patients that do one area, and then they know how it is, and when they come back, I've had patients say like, oh, I'm like, when you going back to work? They say tomorrow, because they're like, my recovery was fine. But first time, I do suggest taking 2 days off, just because your incisions are open. You could be. It's just 2 days is always a good. But I've had patients go back to work the next day. So Thursday and Fridays are very popular surgery days.
You're such a trooper. I could never. Well, this is kind of my job, so. And it's kind of hers. So, ow, 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 ow.
I'm going to show you why it's ow.
Ow, ow.
Let me put more numbing fluid for you.
Can you press on my belly where that just was?
Yeah.
Oh, shit.
Here we go.
That fucking hurts so bad. What is that?
It's a fibrous band. It's attached to your skin, to your muscle. You have a lot of them.
That hurt. Doc, damn it.
Let's put more fluid in for you.
Oh, shit. Now, what would you say that was? A fat tissue something?
That's a fibrous band.
Where do they grow? And why?
Why? Some of it's genetics, and some of it's constant fluctuation in weight. So it happens.
So it's a different kind of fat?
Go ahead. Sorry. Go ahead. Can we up the fluid rate to drink?
Ooh. Ooh. Ow, 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 ow. Oh, shit. Oh.
Okay.
Whew. I'm gonna be able to kick a man to the moon with how much I'm working out these ass cheeks on this table. Squeezing. How long does the procedure take?
It depends on how
many areas you're doing, and it depends on the person's comfortability level and how much fat I have to remove. So it's very, very variable.
It varies.
It varies.
From like what to what?
So,
quickest time, longest time.
Like for a stomach, an average small stomach, probably the actual suctioning out and all of that stuff, probably like an hour.
Okay.
Not even. Sometimes an hour. Because I'm anal, so probably like a little bit like an hour.
Right.
And someone that's a little bit larger, it could take me 2.5.
Okay.
It can take me a little bit. But it varies again with the patients. I mean, a small stomach could sometimes take me as long as a bigger stomach, because the person that's bigger isn't sensitive,
right,
but the smaller one is, and I'm stopping it and putting more fluid in.
Right.
So
like
it really.
Me.
Well, you're not. You're sensitive because there's a reason you're sensitive. Like I can see
Right.
Yeah.
Okay.
You're not sensitive because you're a baby.
I'm not just being a pussy.
Yeah.
Okay.
You're not being a little wimp for a reason. So I'm gonna let the fluid soak up here, okay?
Okay.
And settle in and absorb. I'll go to a different area. This is okay for you?
Yep.
Good.
The fact that it could suck it out through that little tiny thing.
Yeah.
Liquefied in the laser.
It's all liquefied. We've melted it for you.
I don't have to wear the shades anymore at this point. It's just because I like them.
Gotcha. $800.
How much is that?
It's 8 pounds about?
8 pounds of fat so far.
But translates to about half on the scale. It's really, just because it's a pound of fat doesn't mean it's how much is off the scale. So
Okay.
it's about 50%. Like, so it's like if you were to, but honestly, when you get on the scale right after lipo, you're gonna weigh more probably.
Right.
Because of all the fluid and the
Right.
swelling. You doing okay?
Yeah, that hurts a little.
Right over here, you okay?
Yeah. Mhm.
You're fine?
Yep.
Good.
So that push, you're tearing through those?
Yeah, like when you can kind of feel me
When I
going.
feel you pushing
Yeah,
in.
I'm ripping. I'm kind of, yeah. I'm ripping through.
Okay, remember we weren't gonna say that.
I know.
We're gonna say tear through.
Yeah, we're tearing through.
We're tearing through. Something about ripping through them just goes through my body and up my back. Look at the difference. T looks amazing and she ain't even done yet. What is the amount of fat you are permitted to remove?
So by textbook, they say about 5,500. You want to stop when you remove about 5,500 milliliters. We're at 800 right now.
Why is that?
It's because there's no IV or anything like that. You're awake, so we're also removing some electrolytes and stuff. And we don't want to cause a lot of imbalance and shift.
Right. Oh, that is so
So
tender.
you can see this side's a little bit curved in as opposed to this.
Right.
You're curving in. You see?
Yep.
Because it's empty, look. Let me show you. This is a little bit thicker. I still have some stuff, but it's overall, like, it's just I'm pulling up skin as opposed to this.
Right.
So you have some here, and that's how I also determined we need to do a little bit more work here. Because when I was
Gotcha.
pulling up, it didn't feel as empty as it did
empty,
here.
right.
Yep. So it's all about kind of assessing.
It's the vacuum sound for me. You know what I mean? The bzzz.
Is this better now? I
Yeah.
feel more load? Okay.
Yeah. That sounds so dangerous. It's just certain spots hurt a little, but not enough to stop. Yes, it also tightens the skin.
Yes, it does.
So she's using a laser that tightens the skin as it sucks.
No, I don't. No.
Just kidding.
Just kidding.
Just
right.
kidding.
The laser when you had.
Look, she's like, let me get you together, Lee. Let me tell you. Let me let her tell you what she's doing.
So, when we had the lights off, I was lasering. That was melting your fat, and that laser was going to help your skin tighten as the months go by. Now I'm
Gotcha.
just purely sucking out fat.
Gotcha.
You want to see your? Can you see the computer behind you? I'll show you before picture.
Yeah, I did. Horrible before picture.
You doing all right?
Mm-hmm. 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 Watch as I dive in. How many incisions did she make?
I only have 4 for your stomach.
I cannot believe you're getting lipo on live. I'm probably the only person. Am I the only person that's ever done this?
No, we've had a few.
See, I knew I couldn't have been the only one. Especially if people are flying to see you, because that means that the ones that are looking for a really quality doctor are coming from far away. So you're getting influencers, you're getting... Gotta be. I'm cringing, but I can't stop watching. Will there be bleeding later?
There's no, it's not bleeding. The medicine we give you constricts your vessels, so it clamps them down. And also, the laser, it also helps to seal up any leaking vessels when I lasered you. But you will have some, and it's just fluid that you're going to be draining with a little bit of blood. But it's like, imagine you take a cup of water and you drop a red food coloring drop in it. It looks all bloody.
Yeah.
But it's not. It's mainly just fluid. You want Gatorade or you want to drink anything?
No, because I have to pee.
Okay. Do you want to use the bedpan?
That's weird.
Okay.
Maybe in between
stomach.
here and
you can
Oh, we
take to the
definitely
bathroom,
will.
Yeah.
Yeah. We'll definitely take a break for you.
It does not hurt in most of the areas, no. Why did I choose this over traditional lipo? Because it's not quite as invasive. The scarring is minimal. The best doctor that I could find for what I wanted was close by. I didn't want to travel outside of the state or country to get work done. I didn't want those huge scars all over me because I scar really badly. And I wanted something natural looking. I didn't want to look like a video girl. I wanted to look like a hot MILF, not Black China. So, just for what I wanted, it made a lot of sense for me to do it this way because I didn't want all that downtime from lipo, like 7 weeks or whatever it is. Like, I was good on that. Tummy tuck, bullshit, no. Plus, everywhere I went said that this was a good idea for me because my fat was so soft and, et cetera, et cetera, et cetera. Where's my Rona mask at? I don't need it. They're masked up. Am I doing my back also? Yes, but not today. What is the price range for this procedure, and what exactly is it called that you're having done?
She's having smart lipo done, and the price ranges depending on the amount of areas you do and how big the certain area is as well. So it's really hard to kind of think of a package unless you see the person.
So I can tell you, you can get a cheap one done for $7,000. I don't know if that's the way you want to go, but it's possible. But I saw average for the amount of spaces that I was doing was between 12 and 15. Her name is Dr. Patel.
I'm gonna have you put this hand up.
So what is the ideal candidate for something like smart lipo versus like lipo? Because like once you want to lose a certain amount or over a certain amount, then you want to go lipo, right? Like, or is it?
No, smart lipo is definitely better than traditional lipo because in traditional lipo, they're not doing anything to help your skin tighten.
Right, they're just moving all the fat.
It's just sucking up the fat, yeah. Like I mentioned, I do so even for some patients, I'll do traditional.
Hi. Good. How are you?
So for some patients, even when we do BBLs and stuff, because I can't destroy the fat, sometimes we'll suck out the fat, and then we'll go ahead and laser after to just help tighten their skin. Because traditional lipo doesn't do anything.
And we're doing lines.
How's it look?
Looks really good.
So far, so good?
No, it looks a little better than so good. Looks really good.
Yeah, she's melted well too.
Lasered in, so she'll get some nice contrast.
Yeah, she'll get nice contrast. She does have a decent amount of fibrous bands though.
A whole lot of fibrous bands. It hurt.
But like I mentioned, you know, we can stop and put more numbing fluid in, so it's not like you have to suck it up. You doing okay on this side?
Mm-hmm. Does trauma to an area cause the fat to be different?
What kind of trauma?
Like car accidents and that kind of thing?
I mean, they can cause some type of scar tissue and stuff like that.
Oh, just internal scar
yeah,
tissue.
like I mean, the fact that you had 2 C-sections and stuff.
Right.
It's pretty good though.
Mm-hmm. No, I know.
Because like there's certain fat on the body that's really super soft, and then other fat that's
Holy
like
mackerel.
harder.
Yeah, we took out a lot. Yeah, so that fat is different. That's visceral fat. That's like the dad bod.
Yes.
Yeah, that's different fat.
Mine was starting to go dad bod at the top.
Dad bod fat you can't remove with
Hey,
liposuction.
watch it.
Oh, you gotta cut that off, huh?
No, you can only remove that with
visceral
diet
in
and
the
exercise.
muscle,
That's
yeah.
behind
Oh
muscle.
shit.
Dad bod fat is behind muscle.
Oh, that's tragic. Oh, that's awful.
Tell me about it.
So you can't do anything about it?
Diet and
And
exercise.
exercise.
Damn.
So yeah.
So why do men get that and women don't?
No, women get it.
I've seen a lot of women with it.
And it's just what, after being fat for so long, it turns hard, or what?
It's just the fat. Oh, that's the fat overlaying your organs. That's starting to get bigger and bigger. It's protruding. So that causes that bulge.
Right.
Yeah.
Get the hell out of here.
You got a review thing today.
Who? And
Can I read it here?
yes, please. Let's keep bag with Jen.
Oh my God, it's so big. Oh.
You doing okay?
Mm-hmm.
Good.
Yeah, this side's totally fine.
Good. Still doing okay?
Get that under boob.
We gotta get rid of that for you, right?
I've been doing Dr. Goldfarb for 10 years. He's honest and thorough. He's very experienced in this field. He actually is a teaching doctor as well. His work is A+. Pricing is fair. Actually, his pricing beats most, if not all. I trust him 100%. He's my doctor for life. Thank you, Dr. Gold, for making me look and feel better about myself. You're the best.
That's very sweet.
Oh, so nice.
Our patients are great.
Oh, that was so nice.
Ow.
Sorry. I left so much fluid in that area.
All right, doctor. I will see you later.
Okay.
You look good, hon.
Ciao. Thanks.
Looks good. Don't forget the massage when you go home.
I won't.
That's as important as
Have a great day.
That's it. I'll see you later.
Take care.
Take care. Go ahead. Okay, stop. I'm gonna put some by her ribs. Go ahead. Doing okay?
Ooh.
All right.
Woosha. Woosha.
Look how empty you are.
Yeah, it's empty. Gotta do this. Is this okay?
Mm-hmm.
Good. Sure?
Mm-hmm.
Good. Got a good amount of fat up here. You doing okay?
Mm-hmm.
Thanks.
Can you get pregnant after this? Girl, don't wish that shit on me.
Yes, you can. This does not affect your pregnancy, future pregnancies.
If you do, we'll see you next year.
No, hell no. I'm done with kids.
doing okay?
Mm-hmm. Ow, it's more where you're pushing it in and out at. Ouch. The skin right there.
You have 1,200.
It needs lube or something. That hole is drying out. We need to lube it. That shit was burning.
Alright, let it settle. Go to this side. Is this better?
Yes.
Okay, good. Did it hurt?
A little. Ow, 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 ow,
Where
ow,
does it
ow,
hurt?
ow. Right
Does it
there,
hurt
right
right
there.
here?
Yes. Ow.
Alright, I'm gonna let the fluid soak then.
Oh.
You doing okay?
Mm-hmm.
Good.
Recovery time is 2 to 3 days. All right, y'all, my arms are getting tired. I'll be back a little later.